Well, good afternoon, everyone. As well as a regular appearance from the Health and Social Care Minister, I'm delighted to welcome back to the media briefing this afternoon our Head of Mental Health Operations, Ross Bailey. He will give a presentation on the work of his team shortly. Before our discussion on mental health, I would like to invite the Health and Social Care Minister to bring you the latest update, and I know that David would also like to address an issue on how we present our statistics. Over to you, David.
Thank you very much, Chief Minister. The total number of tests undertaken now stands at 3,576. The total completed tests is 3,497, leaving the results of 79 tests outstanding. The total number of cases now stands at 327, which means we have one new positive case since yesterday. And the total number of active cases now stands at 41. While I'm here at the podium, many people will have noticed at the start of the week that we switched from reporting presumed recovered to active cases. This was based on public feedback. So I need to make clear we've not changed the method of calculation. The method of calculation remains the same both for presumed recovered and active. What has changed is that we're reporting on a daily basis active cases rather than the presumed recovered. So we received public feedback where the general public were getting in touch asking us to publish the active case number. The reason people were using the presumed recovered was to calculate back what the number of active cases in the community was, and the feedback was that they wanted the number of active cases rather than them having to take the presumed recovered number and calculate it back themselves. So presumed recovered is still calculated and recorded, as you need that figure obviously in order to calculate the number of active cases. One thing that has come to light, however, now that an audit's been completed, is there was an issue on Friday where the presumed recovered figure was declared too high. It was immediately spotted that it was incorrect after it was released, and the presumed recovered was then paused over the weekend on my instructions for a full recalculation to be undertaken to check it wasn't anything more fundamental. It has been confirmed yesterday that it was not. But I do need to stress that the change to active cases being reported has nothing to do with this. It's purely down to feedback that we have received that what the general public is interested in, and that is what the stats we are publishing is for the general public, is that they want to know the active case number so they can work out how many people in the community currently have COVID-19.
Thank you very much, David, for the stats and for the explanation. And I hope people have had a chance to read the document we published on Monday. It sets out our approach for the next phase of our COVID-19 response. It is, if you like, our flight path for the medium term. We are on the runway with a clear trajectory. To extend the flight metaphor, we will give you our coordinates, our specific next steps in the briefing tomorrow. Our approach is built upon four key policy principles. The first one is protecting life. The second is maintaining our critical national infrastructure. The third is ensuring public safety, confidence and welfare. And the fourth, supporting a controlled return to normality, balancing social, economic and health impacts. You can see that the health and well-being of our people are critical to three of these four key principles. Easing restrictions to get the economy going again is clearly important, but it won't happen without reference to other equally important factors. This is what the Council of Ministers has committed to. While the strict restrictions have without doubt saved lives, they have also, without doubt, had a detrimental impact on some of our people's mental health and well-being. And this is something that is personally very important to me. It is essential that decisions on the next steps on maintaining or easing restrictions take into account the wider health of the population. So our theme today is mental health. We recognise that there has to be a balance between restrictions to suppress the virus and to save lives, and the community's longer-term physical and mental health. So we continue to carefully weigh the harm coronavirus can cause to the community with the harm a prolonged lockdown would cause. It is natural that people will experience increased anxiety, whether from having to stay at home for a prolonged period or from fear of the virus itself. And as I said in Timwell yesterday, I know that as long as the future remains uncertain, this can also cause anxiety. There are financial pressures for many. The worry about not being able to provide for one's family, I know, can cause real stress. And we have seen an increased number of calls reporting domestic abuse. Lockdown has not been easy on our mental health. It affects our moods, our thoughts, our fears, our confidence, our hopes for the future. We must ensure the balance is right. Allowing people more choice in how to live our lives means people can begin to build the thing that everyone, including me, is calling the new normal. This phrase that we are now in, stay safe, opens new possibilities, but this will always be based on being able to do so safely. It is about people respecting rules and making the right decisions. That means stay at home as much as possible. There is more scope to leave the house, but home remains the safest place to be. Social distancing still applies. That means you should remain 2 meters apart from other people, apart from those you live with. With more trips out of the house now allowed, maintaining social distances from others will be harder, and, more important, it will require greater effort and vigilance. It is so important that we do not drop our guard. We have achieved so much. The last thing that any of us want to see is any spike in the spread of the virus. That means we need to reimpose restrictions. The message from the clinicians is clear. We can go back to some kind of normality if we maintain social distancing. Otherwise, we will be switching in and out of emergency measures for a very long time. You, the public, have shown enormous tolerance so far in sticking to the rules and helping suppress the curve. Thank you. The power to continue making progress remains in your hands. During the lockdown, our mental health operations have been under immense pressure, as elsewhere. Ever since I was Health and Social Care Minister, I've taken a keen interest in mental health issues. I know that waiting lists for professional intervention, especially for young people, have been a concern. I know that people's needs have at times exceeded our ability to deliver in recent times. Technological innovations such as online counselling have gone some way to meeting demand. We keep in close touch with developments elsewhere and learn from them, taking on board those that meet our needs. At some time in all our lives, it is likely we or one of those we love will suffer mental illness. And with these uncertain times, I know that we need to be especially resourceful and make sure we have the support and advice in place for those who most need it. It is such an important area, and I would like to hand over to Ross Bailey, our Head of Mental Health Operations, for an update on the work underway across our community. Over to you, Ross.
Thank you, Chief Minister. Once again, thanks for the opportunity to discuss mental health and in particular how as a community we can strive to safeguard our emotional well-being during these difficult times. I indicated at my last briefing appearance that the mental health service provides care and treatment for some 4,500 patients in our community. That's some 5% of the community. Perhaps surprisingly, this figure hasn't increased significantly since the commencement of the lockdown. That said, we recognise that simple volume of referrals is a really poor barometer to determine the collective mental health of the wider community in this context. Whilst our immediate focus as a mental health service was to ensure that we were able to continue to deliver a service to our existing patient group, we are, both as a department and indeed a wider government, extremely conscious of the impact on the wider population, both in the short term and in the months and potentially years to come. To this end, there's been a great deal of proactive cooperation across government departments and charitable organisations to anticipate the need and carefully plan how we will support services in our communities, and in particular, some of our vulnerable groups. I'll expand briefly on this coordinated approach a little later. It's true, however, we are by nature social beings. One could reasonably argue that this sense is more pronounced in a small community such as ours. The overwhelming majority of us thrive in social contact and laments in its absence. Our natural response in times of joy is to share our experiences. We also derive great comfort from social contact in times of need. The coronavirus and the necessary restrictions imposed have fundamentally impacted on our natural instincts. All of us have been impacted, some tragically so. We've been asked to behave in ways until recently seemed inconceivable. Whilst our actions have undoubtedly saved countless lives, the ripple effect has and continue to be profound. There is, however, much we can do both as individual units and as communities that can serve to minimise the impacts. At my last appearance, Dr. Skelding referred to some practical measures we can adopt to manage the potential for anxiety and depression. Whilst far from exhaustive, these included ensuring that we build routine into our daily lives, taking time to exercise, being mindful of our environment, and not immersing ourselves in the torrents of social and mainstream media surrounding COVID-19. These strategies and others are available within the COVID-19 government site under the mental health tab. We've recently added some more resources. These include a suite 12 short videos produced by the psychology team at King's College London. And there's 12 different videos that I'm sure will be of interest. Just to highlight a few, Do I Don't Have COVID-19, the anxiety trap, maximising sleep in these uncertain times, me, myself and exercise during COVID-19, and many, many more. From an individual perspective, it's also incredibly important that we maintain our own, manage our own expectations of what we are and what we can't do. For many of us, in addition to all of the normal pressures associated with life, we're trying to balance home working, sometimes the loss of income, with homeschooling, providing reassurance to a loved one, whilst trying to manage our own anxieties. And this can often feel overwhelming. It's important, therefore, we step back and acknowledge that while spinning all these plates, we're going to make mistakes. We aren't always going to function at our best. When these frustrations start to manifest themselves in negative thoughts, we need to try and acknowledge these thoughts and recognise the negative impact they can have on our feelings, which then drives our behaviour. The ability to identify the relationship between thoughts and feelings and the subsequent impact on our behaviour is an integral approach that many of the most effective forms of psychotherapy rely on. As highlighted previously, there has and continues to be a great deal of coordinated work across government departments to ensure that we identify and prepare for the impact of the pandemic on our communities and particularly our vulnerable groups. The appetite and determination and willingness to work collaboratively across departments and with colleagues in the charitable sector has been extremely reassuring. Our initial focus has been on particular groups where there's an established evidence base supporting the need for intervention. These included groups such as victims of domestic violence, vulnerable children, those with addiction problems, and those experiencing mental health difficulties. As highlighted by the Chief Minister, the issue of the domestic violence is a real concern. Evidence suggests that social isolation resulting from the necessary lockdown measures have proved to be a really fertile environment for domestic violence, the impact of which, both on the primary victim and the children, can't be underestimated. I'd really like to take this opportunity to urge those members of our community who are affected by domestic violence, addiction problems, mental health problems, to please reach out to services. Whilst we may have changed our approach, we're very much still open for business and will do our best and utmost to support you. I want to finish now by reiterating a point that's been rightly repeated throughout these briefings, and that's the staggering degree of resilience and altruism demonstrated by our community. And a dictionary definition of altruism is as follows: demonstrating a selfless desire to help or bring advantage to others, even if it disadvantages you. For me, this sentence encapsulates the sentiment and approach taken by the overwhelming majority of our community. By making these sacrifices, we've managed to safeguard the welfare of many of those who would otherwise be particularly vulnerable to complications associated with COVID. It's this very selflessness in the form of adhering to advice and maintaining social distances that has and will continue to save lives. Thank you.
Okay, thank you so much, Ross. It's great to hear how you and your colleagues are adapting to the situation and rising to the challenges this pandemic has presented. I'm heartened to hear how this has been a truly one-team approach. Thank you, and please pass on my thanks to your colleagues. I will now take questions, and first we have is Simon Richardson from Business 365 magazine. Simon.
Good afternoon, Chief Minister. My first question, if I may, is for Mr. Ashford.
Okay. David.
Thank you.
Good afternoon, Simon.
Good afternoon, Minister. Firstly, could I ask you to clarify the current situation at the Abbotswood nursing home? Has the crisis there stabilised, or does it remain a major concern to you at this time?
It has stabilised, Simon. The last confirmed case in Abbotswood was and it was one case, was on the 3rd of May. There's actually 7 people from Abbotswood who are now classed as recovered from COVID-19. The staff in Abbotswood, both the existing staff and the DHSC staff, have both been working together exceptionally hard to combat the outbreak in the home, and my thanks go out to all of those, but it appears to have stabilised.
Thank you. My second question also for you, if I may. We've seen growing concern in the UK that many people are suffering as a result of being unable to get dental treatment. Some are even resorting, on the news today, to self-dentistry. Is there evidence of a growing crisis in dentistry over here? And can people get emergency treatment in extreme cases?
So there isn't that evidence emerging on the same level. The key thing I need to emphasise is the emergency dentist is still operating. So those who do require an emergency where it is exceptionally serious to their health, they still can receive treatment. The department is looking across all of its services, including dentistry, to see how we can turn them back on. It was essential at the start that we shut dentistry down because dentistry is very much an aerosol generating process with a lot of the procedures they carry out, which makes it a great risk for the dentist and also for the patient, and the deep cleaning that needs to go on between procedures. So we are now speaking to the clinicians about how in a safe and managed way we can turn it back on. It is likely to be staged, so there will be certain procedures that will come back online before others, again based around the aerosol generation, but that is currently being looked at. But the emergency dentist has continued to operate throughout the entire period.
Thank you.
Thank you very much, Simon. And now over to Paul, and Paul Moulton, MTTV. Good afternoon, Paul.
For the Health Minister as well, please, if you don't mind.
Okay. David.
Thank you, David. Just clear up, about the new case, obviously not Abbotswood related, but was it a cluster?
We don't have the tracing information yet, Paul. I might be able to give you more information around that tomorrow. As I said to you, I think previously, it depends when the information's getting logged in the day. Sometimes I've got it for the 4 p.m. briefing. Sometimes I haven't, and unfortunately, this is one of those where it's not ready
That's
yet.
why I ask each day, because you don't actually give it out until someone asks you the question. So sorry about that. This is quite a thing about the deaths now, and I hope you understand why I'm asking this, because in the UK and everywhere else now, they're doing these evaluations on how many people would normally die anyway per time, per week, whatever, and put that into context with what we're getting here. So I believe it's like 1,000 people a year would die on the Isle of Man. That's maybe 200 per month, whatever, and a week, is that right? And then it's about 3 a day or something along those lines. Do you keep that balance? Because obviously it's for people that are understanding how serious we are in this crisis. I'm trying to say, are we bumbling along the bottom basically now? Are we on almost normality rates of deaths in the island?
Right, we do keep that information, but as has been said with the UK, it's far too early to calculate it yet because it is still early days in relation to this virus. So we do have, all deaths are recorded, so we will be able to calculate that back, but it won't be till we have much more data than we do now. And that's exactly the same position that was stressed yesterday in the UK, where people are now trying to make calculations back, but it's unhelpful to be trying to do that in the middle of a year.
All right, and more on the dentist thing, and this business about guidelines for dentistry restarting, I understand they'll need some very specialised PPE, and there should be FFP3 masks if you're doing aerosol generating procedures. I mean, obviously sleeves and gowns and aprons. Are the dentists being geared up for this now for return to work? Because obviously some are NHS and some are private. Have you laid down the criteria for when they can restart?
Well, the first thing I need to make clear, Paul, is other than the emergency dentists are private businesses. They might undertake NHS procedures and be paid for those NHS procedures, but they're not directly linked with the NHS. So in terms of the FFP3 masks that you refer to, that's the type of PPE that, say, would be used on the COVID wards or for a COVID patient in ICU. We do have stock of that. We have enough stock. And one of the things we'll be arranging, we're looking to arrange with the dentists, is as procedures turn on, we will source the PPE potentially for them and provide them with it at cost. Because one of the issues that dentists are finding, particularly I believe even in the UK, is when they're looking to try and stock up, the minimum order they can place from manufacturers is about 10,000 masks. Now, with the best will in the world, a dentist is not going to want to pay out and purchase 10,000 FFP3 masks.
Would it make sense, though, not to get them all geared up, ready to rumble when you release the drawbridge on this one?
Well, let's not get too excited about releasing the drawbridge. As I just said in answer to Simon, it'll be more the drawbridge coming down a piece at a time. It's not going to be suddenly down and it's a free-for-all and everything's back to normal.
But they will need this
with
kit straight
dentistry.
away, won't they? The dentists are going to be high risk, whatever happens, by the nature of their work.
And we have appropriate stock on the island that we will be able to meet the demand when that demand comes.
Thank you.
If I could say, isn't it fantastic that we can say to you all and all the people listening that we have appropriate stock of PPE equipment on the Isle of Man? There are quite a number of countries who cannot say that and have been plagued by sourcing equipment, and I pay tribute to all my team who have been ahead of this game and have ensured that the Isle of Man has always had a good supply of PPE equipment. And just basically for the maths for you, Mr. Moulton, it's circa 80 deaths a month is a sort of our island average, which brings it to around just under the 1,000. But as the health minister has said, it's too early yet to do that comparison. Okay, right. Next we have Josh from ITV. Josh.
Thank you, Chief Minister. Can I start by just asking if we can get some clarification on people visiting friends and family on doorsteps, because there is still some confusion out there. So are you able to go over what the current rules are on going to visit friends and families in their garden, as you've spoken about over the past couple of days?
Yeah, the idea is under the current law, two people can go to visit outside a property. So you can't go into the house. You've clearly got to keep your distancing from that person's house. You can talk to them through a window. You can talk to them through the front door. You can sit in the garden if it's convenient to chat to them, but you must keep your 2-metre distancing. It can only be two people from the same household. Now, we will be making, obviously, changes when we see the latest data tomorrow, and I will be giving you more advice on what the decisions the Council of Ministers makes tomorrow at 4 o'clock. But only two people have to be from the same household. You can't go into the house. You can chat to them through the front door. If the idea is if you've got a garden, they stay in the house and have a chat with you sitting down, or through a window. You can't go into the house, and it must be from the same household, those two people. It's trying to be helpful. The amount of emails I get from people who are lonely, they're in the high risk category, they're not seeing anyone, they're feeling very vulnerable and lonely, or they're on their own especially, then it's trying to help. But we're asking people to be sensible, don't abuse it. But it's all about, and I've trusted the Great Manx public from day one. They've never let me down yet. I'm sure they will follow the rules sensibly.
Yeah, the reason I asked that really is because I've just checked on the COVID-19 government website, and it currently says you must not go see friends and family at their home. So will there be information change just for clarity on those specific things you've mentioned there? Because you must not go see friends and family at their home makes it sound like, don't even go near it kind of thing. Yeah, well, yes, of course, obviously we'll update the website. If it's not clear enough, I'll personally see to that after this meeting. But it can't be two different families going to see
a friend. It has to be from the same household. But obviously, we are looking at various restrictions. I'm delighted that we haven't seen a significant spike. I know I was getting pressurised by one of your colleagues. Would my head be on the block if we saw a horrendous spike as a result of allowing the construction industry back? And I have to say that the buck always stops with me as the Chief Minister, but I'm delighted that so far the data has been really good and that people have been following the rules. Thank you, Joshua.
Thanks.
Right, we have Chris Cave from Energy. Chris, Energy FM. Chris.
Good afternoon, Chief Minister. If I may speak to the Health Minister to begin with, please.
Yeah, certainly.
Hello, Chris.
Good afternoon, Mr. Ashford. Thank you for explaining the discrepancies in the coronavirus figures. You say the presumed recover figure was declared too high, which raises concerns there may have been other inaccuracies in the data which have gone unnoticed. What can you say to put those concerns to bed?
No, as I said in my opening remarks, it was paused, the presumed recovered on Friday, on my instruction over the weekend while an audit was carried out. And it was looked at, and it was Friday. It was to do with certain cases around Friday, and the figure was declared too high by about 10 cases, I think it was.
Was that a human error or incorrect algorithm? Or...
Human error. It's manually calculated.
Okay, thank you for clearing that up. And if I could speak to the Chief Minister as well, please.
Okay there, Chris.
Good afternoon. Could you please give an update on the government's stance on the repatriation scheme and when it's likely a decision will be made on whether or not to continue quarantining returning residents at the Comus Hotel?
Right, well, we've said we'll announce it by the end of the week. I would expect that if people can comply with strict rules and regulations about their ability to go home to an empty house, for example, and that they can be sourced with food and supplies during that period of time, then the rules may well be lifted on them having to go to the Comus, but the Comus will be still needed for people who cannot comply with a set of regulations that we're currently working on, and we will obviously announce the full details and from when it starts as soon as possible, but certainly by the end of the week. Unfortunately, I have to go now. Wednesdays are my day when I have the conference call with the Crown Dependencies in Westminster to get the latest updates and views. So I'm going to hand over to the Health and Social Care Minister, Minister Ashford, to finish off the questions. I think next is Alex Bell from the BBC, and then David will do the shout-outs for me. So thank you all very much, and I'll speak to you all tomorrow afternoon. Thank you. David.
Thank you, Chief Minister. And as the Chief Minister just said, next up we've got you, Alex.
Thank you, Minister. Unfortunately, the UK has now passed a rather grim milestone. It's become the highest COVID death rate country in Europe. Does this put in jeopardy the work that has been done to limit the virus's spread on the Isle of Man? Could it do so in the future?
Well, I mean, the work we've undertaken has been for, the benefit of our community. As the Chief Minister has said many times before, Manx solutions for Manx problems. We don't necessarily focus on what the other jurisdictions are doing. We do what's right for us. In terms of the UK death rate, one of the caveats that always has to go on any country's death rate is it depends on the way their deaths are recorded. So, for instance, are they recording community deaths or just hospital deaths? Different countries are recording it in different ways. But obviously, it is a very grim milestone. And also, we have to remember that the UK actually has a much higher population than Italy. As well. So, while you can't just look at the individual figures, you have to look at, the proportion by population, etc. But yeah, it certainly is a grim milestone. We've said all along that many of our decisions have been driven by what is happening in our neighbours as well, particularly around border control, where the UK has been deemed, in terms of new cases coming in, a major risk to us, and that will still continue to inform our thinking. But going forward, all of the phases, it's about what's right for our community. And I'll use the word again, taking baby steps to move towards the new normal.
And it is, as you say, very much homegrown solutions to problems that we face on the Isle of Man. But I know a lot of the advice that the health service takes on comes from Public Health England. Given the fact that the UK is in this position now, are we looking at other solutions? Are we looking to perhaps distance ourselves from the advice that Public Health England is dispensing?
Well, to be perfectly honest, Alex, we did that a long time ago. We did that pretty much at the start of the outbreak. We've taken measures ahead of where Public Health England has been. So while we engage with them and there is constant communication between Public Health England and ourselves, what we do is based on public health advice here in the Isle of Man. So a lot of the various things, particularly around border control, about the way we've limited movement, that was all ahead of the UK. Ahead of Public Health England advice. So we have actually been varying from that, I think, pretty much from within a week of the first case being identified.
Thank you, Minister.
Okay, next up I've got Jess from Isle of Man Newspapers.
Hello, Health Minister.
Hi, Jess.
So these questions are mainly for the Chief Minister, but he's now away.
I'll give it a go.
Yes. Does the Chief Minister see the state of an emergency being extended beyond May the 15th? That's only 10 days away.
What will matter is the data. And obviously, one of the things that stems from the state of emergency is the regulations under the Emergency Powers Act. If that state of emergency ends, then we would have to bring the regulations forward for Tynwald to potentially continue some of those regulations for at least a 6-month period. So there needs to be an assessment, if it was to end, as what regulations we still need to get Tynwald to approve to keep in place, because without that approval, all those regulations fall. So we'd want, obviously, social distancing still to continue and various other things that are laid out under those regulations. It's too early to say is the simple, honest answer. If I had a crystal ball here at the podium, I'd quite happily give it a go. But it is a wait and see where it's going. And there's other changes we want to bring in or to try and look to bring in that may have an effect on the data. So we need to be very cautious at this stage. But I know it is something people are asking about how do we get out of the state of emergency and back to some form of normality. That is all being assessed at the moment, but it's still too early to say at the moment.
Okay, thank you. Another question I'm hoping you might be able to answer for me is the Treasury Minister seeking to extend
We've lost you a bit
and
there,
the
Jess.
salary support scheme for SS, but cannot go back to work.
Sorry, we lost you completely at the start there. So I literally got the last sentence of it. So sorry, would you be able to... it was something about the Treasury Minister and people who can't go back to work.
Yes, so the Treasury Minister, he said he's seeking to extend MIRA and the salary support scheme for 3 months. Are there any thoughts on providing a top-up grant for businesses who have received the £3,000 CBSS but cannot go back to work?
Well, I'm not privy to all of the thinking going on in Treasury or what they might actually come forward with. At the moment, I have not seen anything around that. But I know that Treasury and the Department for Enterprise are continuously looking at the various schemes. The expansion, I think, of MIRA, I think, will be very much welcomed by employers and employees. And I think will provide some continued support there. As we said, every single response has to be looked at a period in time. We're now moving into the next phase and we need to make sure that the financial support packages are appropriate for that. But in relation to that 3,000 grant, I've not seen anything around saying that there will be another grant available. But as I say, I'm not privy to all the thinking going on in Treasury, but I've certainly seen nothing around that.
Okay, thank you very much.
And next up, I've got Amanda from Gef the Mongoose.
Thank you, Minister, and good afternoon.
Good afternoon, Amanda.
We're hearing that people are finding the lack of dated timeline difficult in the document you released on Monday. Ireland has published an exit strategy with estimated dates. Trust in the Manx public has been mentioned today. Why can't the Isle of Man do the same with rough dates and trust that the public will understand the situation could easily change?
Because personally, we don't think it's responsible to be putting timelines on this, because as I've said before, it's not just a forward step. If we do something and then there's a spike in the data or there's higher contagion, then basically what we might need to do is even unwind things and go backwards. As the Chief Minister alluded to in his opening remarks, one of the things we don't want to end up doing, but is going backwards and forwards between different measures. But if necessary, we will have to do that. What people need to know is how we are going to take certain processes forward, and the phasing, I think, is very, very clear, so people know where they are at any one time. But I think, as I stated in Tim Will Jeste, when you start putting timelines on things, it gets people's hopes up. And I do not think it is responsible as a government to be falsely putting out timelines that get people's hopes up, and think that on this date that's fine, and my business is going to be reopened, everything's going to start returning to normal, only to have those hopes dashed. There is a lot of anxiety out there, which we fully acknowledge with all the changes that have happened, and I don't think it's good to add to that anxiety, where even if people have got in the back of their mind thinking something is going to happen on this date and then it doesn't, I think it just drives people further down the line of the anxiety. What's important is to have the phasing so people can see at any one time where the island is.
Thank you, Minister. And secondly, young children build up their immune systems when they're in school or nursery playing with other children, which is key to their immune systems. Are you concerned about the effect that social distancing will have on that, and what will you do to tackle it?
Well, the schools and nurseries can't stay shut forever. Let's be honest about that. At some point, as the Minister for Education has spoken about at this podium, I think when he was here, was it last Saturday, I think, he spoke about how it would have to be done in a phased approach with schools. Obviously, children mixing with other children does build up immunity. There's several things, I believe, that show that. But what's important is we do things in a managed way, because what we don't equally want is a lot of children contracting COVID-19 around that age group. We want to keep our children safe as well as the rest of the population. So anything we do has to be done in a safe way. It's like all services, it's a balance. There are key services within health that we have had to turn off during this emergency in order to redeploy and reprioritise staff elsewhere. Now, that has caused problems for people, and I'm the first to admit it, particularly around cancer services, but it was necessary for the response. We now have to look at how we unwind that and get those services back online, and education is no different with that. Okay, next up I've got Tim from Manx Radio.
Mastermind, Minister, I too had some questions for the Chief Minister, so we'll come up with some others.
I'll give it a shot, Tim.
No, we'll come up with others. Aside from education, what effect, in your view, is the current regime having on the mental health and social development of youngsters?
Well, obviously, it's a concerning time for children. I'll bring Ross in a minute, since we've mentioned mental health. You've all been quite light on him today. You've not asked him anything yet, so I'll bring Ross in a second, put him on the spot. But in terms of children, I mean, obviously, it is a concerning time, particularly young children. They don't understand what's happening. They don't understand why they can't see their friends, why they can't even see some of their family. And it is a different routine. So there is an impact, I would say, and it is one that we need to have something in place to address. But I'll bring Ross in if he wants to comment further on that.
Yeah, I think I think in terms of children returning to school, first of all, I think if there's sort of mental health problems or anxiety within the family unit, which invariably there will be at this difficult time, that's going to have an impact on children. I'm sure the overall majority of people try and safeguard their children, reassure their children, do their best. I think children returning to school, many children would have had a great time being at home, spending more time with their family. But for some children, being at home, they can be quite vulnerable, and it would be a very, very difficult and challenging time for them. So it really is quite a wide spectrum, and I think we need to be very, very cautious and do this very much in a planned way in terms of how children are reintegrated back into school. And I'm absolutely fully aware that those plans have been undertaken with my colleagues in education. But of course, it has a profound impact on children. And I know the CAMS team, we're working to prepare and offer services for what will be, we anticipate an increased number of referrals, particularly as schools start to come back online.
Just to follow up on that, have you seen an increase in referrals already?
I'll bring Ross in.
We haven't. I suppose, as I said earlier in my discussion, we've not seen an increase in the referrals right across the board. There's been some marginal increases in some places, but really not what we was anticipating. I think what we are anticipating, what the evidence base suggests, is that later on down the line, in the weeks and months and even years to come, we're going to see the implications of this because of the economic impacts, because of the impacts on families. So we're busily planning for that right across departments. It's not just Department of my area, mental health, or even the wider DHSC. It's right across government and working collaboratively with other agencies because the mental health service is one tool in the toolbox. And we need a much more, holistic approach to dealing with these problems. But we're absolutely undertaking an awful lot of planning to prepare for what we see as a result is required in the coming times.
And what about the mental health of those quarantined at Comus or in the isolation wing at the prison? Some have not even been convicted; they're on remand. Have basic human rights gone out of the window under these current emergency powers?
Well, the first thing I need to say, Tim, is everything we've done complies with human rights law. We receive legal advice from the Attorney General's chambers in all of the things that we do, and we are obviously very cognizant of human rights. The actions we have taken perfectly comply with our international obligations. We have had that advice to that effect. In relation to the Comus, I can't speak about the prison, but because I don't have that information, but in relation to the Comus, I know welfare checks have been done on all the residents currently in the Comus. In fact, there was some calls, I think, over the weekend to some of those residents, and off that, certain actions have been taken, and people have been put in touch with support networks where required.
Just with Ross there, I mean,
I'll bring Ross in as well.
Quarantine for long periods like that, 2 weeks. What effect does that have on people's mental capacity?
I think it's difficult to make that judgment. We're all different. We've all got different sort of resiliences and networks of support around us. I mean, what I can assure you of is that we've been working closely with colleagues across departments, so to set up mechanisms. So if someone does require mental health support whilst they're in the Comus, we're more than able and have provided it up to this stage. So we're health screening people before they come onto the island to identify any chronic mental health or physical health problems and referring to the relevant agencies before they even arrive on the island. So that's happened in that procedural process has been happened over the last few days.
Okay, and then I've got Leanne from 3FM.
Good afternoon, Minister.
Good afternoon, Leanne.
My first question, I'm not 100% sure if you'll have the data with you, but do you know if there have been any cases of coronavirus as a result of people returning to the construction industry?
I don't have the data for today's case at all, but I can actually say that there has been no link identified with any of the other cases since the construction industry returned back.
Okay, thank you. And my second question is for Mr. Bailey, if he's available, please.
Yes, certainly, Ross.
Okay, this is just an inquiry we've had from a few people from the public. They're wondering what mental health support is being provided to healthcare workers, obviously due to the immense physical, mental and emotional strain they must be under during the pandemic.
It's a really good question. I think I certainly know from my experience and my colleagues that there's been a huge impact, both physically and mentally in undertaking the work, and it's incredibly demanding. We actually spoke about this in some detail at our leadership meeting this morning, and we've got packages of cognitive behavioural therapy that we're rolling out across the department that people can access independently. We've also got the staff welfare line set up with links to relevant specialisms within that. So we're absolutely conscious that we need to look after those caregivers and ensure we support and safeguard their mental well-being as well as their physical. It's incredibly important. It's a really good point.
Thank you very much.
Okay, thank you very much to our media partners as always. Moving on now to the shout-outs. The first shout-out today is for Stuart Colligan. Stuart wrote to me to give his views on the way the coronavirus pandemic has been handled by the Manx government. He wants to give back and has made a very generous personal donation to the Department of Health and Social Care. Stuart simply asked that it be spent on something that would make a difference. Stuart is the founder of consultancy firm Oxazea, which has in happier times provided sponsorship for community events, clubs, charities and talented individuals. This personal donation from Stuart will fund a new teledermatology service. This is a system where images are sent directly from GPs to dermatologists. It will allow for a virtual diagnosis and a more streamlined treatment pathway for all patients, but in particular those with high-risk skin cancers. Images of the lesions are taken by dermatoscopes, if I can say it right, and iPads are used to give macro images. The details are then sent by secure email between clinicians. There are similarities with other forms of telemedicine, but this will be a new development for the Isle of Man. The implementation of teledermatology will enable advanced triage, prioritisation of patients and telephone consultations during the current pandemic and just as crucially into the future. So Steve, on behalf of the government, thank you very much indeed. The second shout out goes to Nicola Howard, a mental health nurse who worked at the Grandstand and is now on the team at Abbotswood. Nicola is also secretary of the Laxey Minor Birds WI, and in what spare time she has is still working hard for them to provide community support. It is good to know we have people like you, Nicola, so thank you for everything that you're doing. The third shout out goes to our staff welfare team. They are running an emotional support line for DHSC staff during the COVID-19 crisis. Staff who feel frazzled or overwhelmed can pick up the phone and talk things through with someone who understands and will listen. The team can offer practical advice on ways to maintain resilience and enhance the coping strategies that staff already have. Calls are answered 7 days a week from 8 a.m. until 6 p.m. So thank you to the staff welfare team for helping to support our NHS heroes at this challenging time. So that is it for today. Thank you to everyone for watching and for our media partners again for taking part as always. Please continue to socially distance. Stay at home if possible. Self-isolate if you are told to. Wash your hands for 20 seconds throughout the day. Please make the right decisions for you, for your family and for your island. Stay safe. Thank you very much.
Thank you all for staying at home where possible.
We hope you're staying positive in these challenging times.
We've come so far.
As we move forward into the next stage,
please continue to stay at home whenever possible.
And we will continue to keep you safe.
Make sensible choices.
Your actions are vital.
Please play your part.
For you, for our island and for our community.
Please stay home where possible.
For you, our island and our community.
Please stay home where possible.
Stay safe.
Stay safe.
Stay safe.
Stay safe.
Stay safe.
Stay safe.